We're going to move on to the second part of our gram-negative cocci lecture. And in this lecture, we are going to focus on the organism Neisseria meningitidis. Now, Neisseria meningitidis is the other major pathogen in the genus Neisseria. So we already talked about Neisseria gonorrhea in the first lecture. And in this lecture, Neisseria meningitidis, since it is a major pathogen, we will first discuss its virulence factors. So it does have pili for adherence. It can produce a capsule, and the capsule is what allows the organism, and Neisseria meningitidis is nicknamed meningococcus. So the capsule is what allows the organism to be divided or subdivided into 9 serogroups. It is a gram-negative organism, so it produces endotoxin or LPS. It does produce protease, and it produces cellular membrane proteins. So it produces a lot of the same virulence factors as Neisseria gonorrhea, but it does have a few of its own distinct virulence factors that we would get into much more detail if we were in an infectious disease pathogenesis course. Now, Neisseria meningitidis can cause a nasopharyngeal infection, which is usually asymptomatic. The organism will attach to the non-ciliated columnar cells. It gets phagocytosed by the host immune cells, granulocytic cells, and then the endotoxin or LPS in the gram-negative cell wall will be released because the cells will die. And if you remember, gram-negative cells, when they die, they release endotoxin, will start to damage the adjacent or nearby ciliated cells. And so it will lead to a nasopharyngeal infection, possibly a mild sore throat. Usually it doesn't amount to anything that major. Now, the major problem with Neisseria meningitidis infection is meningitis. So the most common form of disease caused by Neisseria meningitidis is meningitis. And the peak incidence of Neisseria meningitidis causing meningitis is in young adults. So meningitis is very common among college students, and there are college outbreaks that occur. What happens is Neisseria meningitidis is normal flora in the upper respiratory tract. People carry the organism, and there are individuals that are highly susceptible to becoming infected by it, and it causes an acute purulent meningitis. So the symptoms of this are a very abrupt, severe headache, which leads to a stiff neck, sometimes a fever, but not always. And the distinguishing feature of Neisseria meningitidis meningitis is this petechial rash, this little purple splotchy rash that occurs all over the body. The problem with meningitis caused by Neisseria meningitidis is that it is very rapidly lethal. So what commonly happens, and unfortunately this happens in college campuses all over the place, is you'll be sitting in class and you'll be starting to say, boy, I've got this headache, it's terrible. Go home, tell your roommate, I've got this really, really bad headache. I don't know, I'm going to just go lay down for a little bit. Lay down, and what happens commonly is by the next morning, the roommate will wake up and their person that was sleeping is sometimes dead or is very severely and ill, can't even get out of bed. And by the time they get into the emergency room and get treated, many times it's too late. So unfortunately, Neisseria meningitidis is a highly fatal infection. Now, Neisseria meningitis can also get into the bloodstream and cause meningococcemia, and if it gets into the bloodstream, that can also cause meningitis. So it can cause a bloodstream infection either with or without meningitis. This has a 25% mortality rate. You can see blood in the skin, almost like bruises, the petechial rash. An individual have an increased heart rate, low blood pressure. It can become a fulminant infection very quickly, spread throughout the body. It could cause DIC, or disseminated intravascular coagulation. It can lead to septic shock. Neisseria meningitis disseminated infection can cause what's called Waterhouse-Friderichsen syndrome, which causes hemorrhaging in the adrenal glands and leads to kidney failure, and death can occur within 12 to 48 hours. So here is this meningococcal rash that commonly develops in an individual with Neisseria meningitis, meningitis, or meningococcemia. So this little purple red splotches all over the body. So again, this organism, unlike Neisseria gonorrhea, which is never normal flora, Neisseria meningitis is and can be normal flora. So it can reside in the mucous membranes and carried in the upper respiratory tract of perfectly healthy individuals. It's transmitted through respiratory droplets, usually in individuals that are carrying the organism and are not susceptible to it at all, and then someone that happens to be in close proximity of that individual who happens to be susceptible ends up getting disease. So this is more common a cause of infection in individuals in close contact. So it's much more common in military barracks and in college dormitories. In order to diagnose Neisseria meningitis, you usually, since it causes meningitis, it's usually diagnosed off of a cerebral spinal fluid sample. It can be a blood sample, possibly a nasopharyngeal swab or an aspirate, sputum, possibly, although very rarely, and urogenital sites. I mean, definitely the most common patient specimen that you would get to isolate Neisseria meningitis would be a spinal fluid specimen. Now, in spinal fluid, you will do a direct microscopic examination. So you will plate out the spinal fluid on growth media, selective media. You'll do your typical micro types of tests on it, but spinal fluid is one of the specimens you'll get in the laboratory where you will immediately take a slide and do a gram stain of it and see, especially a spinal fluid, if spinal fluids are sterile, just like blood. Blood is sterile. You should not see any bacteria in a spinal fluid or a blood specimen. If you see any bacteria in a spinal fluid or a blood specimen, it is considered a critical result, and the ordering physician is contacted immediately to let them know. So in the case of Neisseria meningitis, if you have a spinal fluid that you gram stain and it contains, you see a lot of white blood cells and you see gram-negative diplococci and intracellular gram-negative diplococci, that is a neon sign that this individual has Neisseria meningitis infection. And because the Neisseria meningitis commonly has a capsule, you might see a little halo around the organism, because remember, the capsule doesn't pick up the stain. So here would be a spinal fluid direct stain. So the spinal fluid comes in, you would make a smear on a slide, you would allow it to dry, you'd have to fix it and stain it, and then you would see your white blood cells, and you would see both intracellular and extracellular gram-negative diplococci. That would be an immediate diagnosis of Neisseria meningitidis, and that individual would be treated likely before you even hung up the phone. You would also culture the spinal fluid or blood specimen, whatever specimen came in, and you would use both selective and non-selective media. So you would always, for particular specimens, when you're working in the lab, there's a certain group of media that are always inoculated. So for a respiratory specimen, you're usually always going to inoculate a blood agar plate and a chocolate agar plate. So for a spinal fluid, you would likely inoculate definitely a blood and a chocolate. And certain labs have certain criteria, so they're not all the same. You can go into one lab and for a certain specimen, they may only plate out blood and chocolate. But you might go to another lab and they might plate out 3 different plates or 4 different plates. So you always have to follow whatever the rules are in the laboratory that you're working in. There's always going to be a minimum. There's always certain media that you're always going to inoculate for a particular type of specimen. And then some labs do a little bit more than that. So you are then going to incubate your media in 5% carbon dioxide. So certain specimens like respiratory specimens, spinal fluids, it's going to depend, but there are certain specimens that always go into the CO2 incubator because you're trying to grow organisms like Neisseria meningitidis. So the Neisseria meningitidis, as well as the non-pathogenic Neisseria species, will grow on your 5% sheet blood agar plates as well as chocolate. Now Neisseria gonorrhea, the other pathogenic Neisseria, will not grow on sheet blood agar plates. So there's a difference between the two pathogens. One grows on sheet blood agar and one does not. So here is Neisseria meningitidis after 48 hours. On the left is chocolate agar, and on the right is the 5% sheet blood agar. So you could see the organism is, it's not a huge organism. Remember, this is 2 days of growth. So after 1 day, when you would commonly look at your plates after overnight growth of about 18 to 24 hours, that organism is pretty small. Prevention and control, if someone that you know or that you've been in contact with comes down with meningitis caused by Neisseria meningitidis, you would be put on antibiotics. So you would get chemoprophylaxis. There are vaccines available now. Previously, vaccines were only available for military personnel. Now there are vaccines, and most college campuses will not allow students to come in until they've proven that they've been vaccinated. There is a poor antibody response in young children, but in young adults and adults, there is a very good antibody response, and vaccination is highly effective. Reducing carriers by chemoprophylaxis, first identifying the carriers and then treating them, is another way to prevent infection. Now, Neisseria meningitidis is a very dangerous organism. There have been several cases of lab infections. So, for example, there were 2 cases of a fatal laboratory-acquired meningococcal infection in clinical microbiology laboratory workers. And this is commonly due to examining plates and patient specimens out on the bench top. So I know There was one case where an individual vortexed a specimen, and if you know what a vortex is, it kind of whips around a liquid and then opened up the lid, which generated an aerosol, and this was done out on the bench top. And so the person who was working on the specimen breathed in Neisseria meningitidis and died from Neisseria meningitidis meningitis 24 hours later. So Neisseria meningitidis is one of the organisms and one of the reasons why all patient specimens now, when they come into the lab, way back when I was starting out, we inoculated everything on the bench top. Now every patient specimen is opened up, and initial processing of the specimen is done in a biosafety cabinet. So that's going to reduce the risk of inhaling any potential aerosols from highly infectious agents such as Neisseria meningitidis. So, there have been new vaccines that have come out. One of the newer ones is Menectra, that's approved for people who are 11 to 55 years of age. Every few years there's new and improved vaccines that have been coming out. Treatment for Neisseria meningitidis is penicillin, and the reason is penicillin is one of the antibiotics that can actually penetrate into the meninges. A lot of antibiotics are too big and they're not soluble enough, they cannot get into the meninges in order to fight the infection. So you need, not only with an organism like meningitis that gets into the meninges, not only do you need to get an antibiotic that is effective, but you need to get an antibiotic that will get into that area. So now we're going to move on to the third part of the gram-negative cocci lecture.